Hi, I will be giving a case study today on Mr. David Najar, a 60 years old man who has a COVID-19 related exacerbation of chronic obstructive pulmonary disease, COPD. He has a symptom of fever, sore throat, productive cough, and dyspnea. Also, he has a history of hypertension and hyperlipidemia and currently respiratory distress indicated on his ABG result. To maximize Mr. Nazar's care, we will go through evaluating the A2E assessment, pinpoint diagnostic findings, talk about important nursing interventions, and look for treatment management. So first, we're going to go through A2E assessment and clinical decision making. So first, airway for Mr. Nazar, he has a patent airway, which means he can breathe on his. However, he is having productive cough. He will be required to keep his airway open. Airway open can be performed by sitting position and chin lift. Breathing assessment, Mr. Nazar's respiratory rate is 30 breaths per minute and his oxygen saturation is 78% on lumen. Non-invasive methods to manage a patient suffering short of breath involve improving oxygenation with an oxygen delivery equipment, which is nasal prong, and NIV, non-invasive ventilation. In circulation assessment, his heart rate of 128 per minute and blood pressure of 168/85, which indicate tachycardia and hypertension. He need to be obtained his ECG monitor, screening for any dysarrhythmia with continuous ECG is crucial to prevent and rapidly treat complications. Regularly monitor vital signs also need to be commenced. Tachycardia may influence other vital signs, such as causing a drop in blood pressure, while insufficient blood flow to vital organs can lead to clinical emergency. Disability assessment, Mr. Nadra's DCS score of 14 out of 15. Confusion and discomfort may be a sign of an acute exacerbation of COPD of hypoxemia. Ongoing neurological assessment are crucial for patients who is experiencing confusion with a focus on cognitive function and risk of hypoxic brain injury. Exposure for him, Mr. Najar has a fever, which is one of infective symptoms. Administration of antibiotic can be commenced for patients presenting fever. The second question is, we're gonna go through for nursing interventions. So first one, I got a A2E assessment. Continuous monitoring of Mr. Najar's A2E assessment is essential, with close attention to any changes that may indicate significant changes. The second, I got a ABG monitor, which is the anterior blood gas. The rationale of ABG analysis is essential to assess the degree of hypoxemia and hypercapnia, which are signs of a decreased pulmonary gas exchange from the exacerbation of COPD. Third one, I got oxygen therapy as Mr. Najar's care plan with his aim goal oxygen saturation 80 to 92. Type 2 respiratory failure can be treated with the NIV to assist in the removal of carbon dioxide from the body. Last one, I got a pharmacological treatment of infection. Early administration of broad-spectrum antibiotics, which target bacterial infections contributing to COPD exacerbation, can effectively reduce both severity and duration of these episodes. So last question, we got nursing considerations. So first one, we got oxygen therapy assessment for him, monitor vital signs, including oxygen saturation closely. According to Mr. Nazar's care plan, NIV or nasal bronchs can be commenced. It will need to be continuous monitor his aim range of oxygen saturation, 80 to 92. He will also require nursing assistance with his oxygen device, such as oxygen tank, while he undertakes other tests such as eating, drinking, or using restroom. Also, we got a side effect for this. Inadequate use of oxygen device or therapy can lead to hypocapnia and organ dysfunction as well. Second, we got a salbutamol, which is bentorin, monitoring his heart rate and respiratory rate and oxygen saturation and lung sounds, educating him to use with instructions. 1 to 2 oral inhalations may repeat every 4 hours. It can be commenced by a doctor's order. Side effect for this is tachycardia and palpitation, headache, nausea, warm sensation. That's why we need to monitor his heart rate, respiratory rate, oxygen saturation. Third one, we got an apratropium, which is atrial band, monitoring his heart rate, also respiratory rate, oxygen saturation, and his lung sounds. It also need to educating him to use with right instructions. 2 puffs, 3 to 4 times, up to 4 puffs if it's necessary by MIM Australia. It can be commenced by doctor's order as well. Side effects are headache, dizziness, throat irritation, cough, GI upset, and dry mouth. Fourth, we got antithromycin, which is a Zithromax. Monitor patients' anaphylaxis symptoms and medical history for azithromycin is important. It constitutes with 4.8 milliliter water per injection and dilate in 500 milliliter admin by IV infusion before or 2-3 hours after meal. Side effects are GI upset and arrhythmia and dizziness and also headache. Last, we got niamarlabor and litonavir, monitoring Mr. Nadra's COVID-19 progression. Hypertensivity and drug integrations and adverse effect, and also his renal and liver function will be required for this drug. The standard treatment involves administering niamarlabor is 300 milligrams alongside the litonavir 100 milligrams, taken orally twice daily for 5 days. Side effects are urticaria and angioedema, itchiness, and dyspnea. In summary, through the A2E assessment and the right evidence-based treatments are essential to managing COPD exacerbation, especially regarding COVID-19. We can provide Mr. Nazar the best care possible in this clinical situation by keeping a close eye on his vital signs, giving him proper protocol of treatment, and focusing on oxygen therapy aimed to his ideal goal range. Thank you.